My career started as a medical student at the University of Melbourne. I subsequently worked as an intern registrar at the Royal Melbourne Hospital. I particularly didn't want to give up bits of people so that colleagues would have to manage bits of them, and I just managed some bits. I didn't like that idea. So that was the reason that I chose to practice as a consultant general physician. I first started thinking of retirement when two of our children who had lived abroad for many years had their own children, and my wife and I wanted to make a very high priority of our lives being active grandparents for as long as that was possible. My wife and I had always shared a private office, so that it was a kind of a joint discussion about lifestyle, really. And so the question of partial retirement came up at that time. I think the pleasures from my work firstly came from working out what was going on in a particular patient I'd never seen before in about an hour or so. It became my practice for the last 25 years never to read anything about a patient until I'd talked to them myself and examined them myself and made up my own mind, and then looked at the letters from colleagues and other information. And in some ways, seeing a new patient was like opening a present, opening a sort of Christmas present or something like that, and you didn't quite know what was inside. I was certainly anxious about not being able to continue to see patients who, to the best of my capacity, I'd looked after. But on the other hand, I knew that I've been involved and enjoyed teaching all of my life, and I know that there are people who are with better skills and more competent than me to take them on. And it was a privilege for me to find people, to kind of hand-pick particular people for patients. I didn't think that I possessed a unique skill by any means. But in the year or 18 months after my wife and I made that choice and planned ahead, a year, 18 months meant that I'd see most of the patients who I'd see on a regular basis. So, we'd spend about half the consultation working out who was going to be the person who'd look after them. I guess I'd like my colleagues to know that changing work patterns, and I think it's better to think of changing work patterns rather than as retirement, is or can be and has been for me a very positive aspect of life.